This is Find Your Flow, a show about navigating the complexities of life and business through the lens of curiosity. I'm your host, Angelique, and I bring together experts to deliver responsibly curated conversations and perspectives that aim to progress people and the planet. A topic that is transforming the way we approach healthcare: artificial intelligence. So today we're going to take a deep dive into the incredible ways that AI is reshaping patient care, diagnostics, and even medical research, as well as discussing some of the challenges and ethical considerations that are surrounding the integration of AI in healthcare. And my guest today, with a lot of experience and exciting experiences in this space, is Vanessa Donohue. She is the Vice President of Healthcare at Antenna Group. She's a seasoned professional, somebody that I've known for many years, both professionally and personally, and has over a decade of experience in the healthcare industry, specializing in both business to business as well as B2C communications. She has served in healthcare conglomerates and startups alike and loves to build and execute strategies for a number of integrated marketing campaigns. Vanessa, so good to have you today. Thank you for joining.
Thanks for having me. I'm thrilled to be here.
So how this conversation got started is you had a great recap about some of your recent experiences at conferences and even on some panels that you've been speaking on. One of those that you even recently attended was the HIMSS conference in North Carolina. So I'm curious, let's dive into maybe some of the top 3 takeaways of this event and tell us a little bit about what that event was about.
Yeah, so it's very hard to pick 3. I will say that was probably the first challenge, but trying to boil it down, I would really talk about, I think the biggest theme, it was the keynote that came out, which is preventative medicine, or also known as lifestyle medicine. So that's something that we've heard before, but really AI, which that'll be the red thread throughout all of the 3 themes. But really AI is now making this possible and expediting bringing this vision to life.
Wow. So what stood out most for you?
So for that one, continuing on the trail of AI is the possibility of that. So recently, like I said, we've talked about preventative medicine forever, but recently Netflix released a series, I highly recommend it, on blue zones. And so that's the theory about making these lifestyle changes. So it's nutrition, it's exercise as medicine, even mental health, understanding stress management, because we know stress has a significant impact on our overall well-being. Mm-hmm. And so making these lifestyle changes, it's not new, but again, with anything that comes on Netflix, we have heightened awareness. So with that, how do we make this possible? And I actually am wearing my Whoop. That was one of the wearables mentioned, but the Aura ring was mentioned. Mm-hmm. There's a number of different wearables, but AI-driven technology that's actually telling us how our bodies are performing to better help us understand, okay, yes, when I'm following this type of diet, when I'm doing this type of exercise, when I should be doing a breathing exercise, I'm seeing my stress levels rise. We have access to actually understand what our bodies are doing and how they're reacting more than ever before because of this AI-driven data.
Oh, wow. Absolutely. And I'm not one with the wearables just yet. That's not a market that I'm into, but yeah. One of the things I love to hear is talking about blue zones. This is something where it's more popular now, but it's something that I've heard about several years ago, and just the understanding of the wheel of health, how many things play into whole health. And it's not just about eating healthy and fitness. Like you said, it is about your mental health. And one other thing I would mention is the aspect of community and how much community and community support can play into that. Now, when it comes to the technology itself and the technology that is driving some of this preventative care, what are some of the, I guess, most profound findings? What is the data saying? What sticks out most for you in regards to what they're saying of the data?
Yeah, so actually this would bring me into my second topic, but it is that it's personal. And so the personalization of the data is critical because we all have a different baseline and we all live in different, whether it's geography or socioeconomic, all of these different factors make up a person, right? And so the data, what surprised me personally was understanding that it's not just knowing what's best for everybody, but it's what's best for me, what's best for you. And numbers have different meaning based off of different baselines. So one of the examples, like you said, it's not just, exercise is fitness, right? But it's easy for our minds to go there. And so one of the AI technologies that were demonstrated was actual equipment that wellness centers are using. And so if you get on that machine and I get on that machine, it's going to tell us to do different things.
Right.
And the way that I'm working out and the way my body is performing, that AI data can actually say, hey, Vanessa, if you keep moving at this pace or this type of movement, you're actually subject to injury. And so the personalization really impressed me, that it's beyond just knowing the numbers, but it's really knowing your numbers and what they mean for you.
So the one question that pops into my mind when you say the personalization of data. So I understand, you had a wearable, it's tracking the things that you're doing. How does HIPAA come into play with data like this, and how it's shared and how it makes decisions and how it essentially we have to train AI. So what does that look like in the healthcare space?
It's such a good question. There's so many thoughts I could share on that. But the one immediate thing is actually that question that you asked, at the end of all these panel sessions, there's the Q&A. And so that was a big, question, hands raised around it. And so a lot of these AI technologies that are out in the wild today, they are actually HIPAA compliant. A lot of them make very specific efforts to ensure that they are regulated. The other thing I will say is this has opened up a space for more companies to come in with protective solutions and make sure that data is private. A lot of examples that were shared, these patients are opting in to share their data, and they can always opt out. So there are a lot of contingencies in place. But to your point, I went to a event prior to this, the NC Chamber Healthcare event, and there was a lot of talk about governance. And so while we are understanding there's a responsibility when it comes to accessing this data, we're still kind of in the wild west of AI. I mean, we're rapidly evolving. And so there was a charge to those healthcare leaders and stakeholders to take that responsibility in terms of, the ethical use of data as well.
Yes. I mean, that's a big question surrounding ethics is a big question surrounding AI as a whole. How do we regulate it? How do we maintain control over it? Because like I said, I mean, the more information that the more information we feed it, the smarter it gets, the more information and ideas it's able to spew back at us. So it's good. And not, I'm not all surprised that that's already a conversation, especially in a industry like the healthcare space.
So you kind of just triggered something else, actually, the third topic, which is health equity. And so one of the other components of this, and what you're getting at here, is making sure that are we asking the right questions when it comes to enabling AI? And you're absolutely right. So the AI tool is only as good as the data we feed it, kind of like our bodies, right? So ultimately, we have to make sure that we're asking, was this AI, what it's spitting out, was it actually tested on diverse data and populations? And so you're right. In the NC Chamber event, one of the biggest themes there was this quote, a human must be in the loop. And so the way that we're leveraging AI, there's a lot of quotes actually that really stuck out to me. Another one was, well, what's the risk of not using it, right? Like we're doing more harm than good, but at the same time, we have to balance that. And so the AI, we definitely have to use it and test it and try with it, but a human has to be in the driver's seat. The AI is the GPS. It tells us where to go, but at the end of the day, for any Office fans that have watched Michael Scott drive into the lake, I don't know if you remember that episode, he was just solely relying on the GPS and following it. We have to have a human driver, but we can use it as a tool to help get us there faster, get us there more efficiently. So yeah, I think there's a lot of responsibility, but also a lot of opportunity.
So many thoughts come up with that, because you are right. I mean, the more information that we're giving it, we have to make sure that we're honing in what we're using it for. I personally, I'm a daily user of AI at this point, a daily user. And what I found is that I can be incredibly efficient, because those moments of creative block, those moments of I just, kind of need to think through how I want to ask this question in an intelligent way to get the information that I need. And so many times it comes through with just sparking that next level of thinking for me. And it's interesting to think about, especially on the health equity space. how do we make something like AI think in that capacity? And this bridges into, another almost frustration that I have in the healthcare space, and especially in that of self-care and wellness, is so many of these things, these wearables that we have, these Aura rings. I mean, so much of this technology is at a price point that is premium to many people that, honestly, I would beg to say the people who need it most can't have access to. So how do you bridge that gap between what AI can do and how we can make something more accessible for underserved communities? And that's a really big question to ask. So I'm like, solve this.
So personally, am I going to solve it? No, but but are people working on it? Yes. And so actually, I'm really glad you asked that, because it is something that I covered in the ebook that I wrote. So I did an ebook about how AI can actually pave the way for preventative care. And in that, I talked about the Whoop and the wearables, but also the disparity of not everybody has access to those. So in the ebook, which I hope people will check out, I actually called out companies who are addressing this issue. And so there's a couple examples sprinkled in there, but at the end of the day, it is going to be community leaders and healthcare facilities that have to be intentional. We have to not get so focused in on the excitement, right, of what AI's promise is and all these technologies, and look so forward ahead that we're not looking around us at who's marginalized and left out. And so these companies are doing everything from, instilling programs to make sure that, and some hospital facilities are actually sending patients home with remote patient monitoring. So they're able to do hospital at home care. So, that helps both the patient and the clinician have more dialogue and access to take more control of their care, and could splinter off here, but even alleviate some of the physician burnout and staffing load, right, by doing that hospital at home type care. So they are, whether it's enabling patients with the tools they need or creating community programs. I work with a hospital system who actually goes into the community, and they do different exercise programs and things like that. But in terms of that, health equity, it's not going to be one silver bullet solution. Don't give everybody a Fitbit, right? But, there's going to be different layers to this, but there's absolutely leaders and stakeholders and companies that are taking the charge. And the one thing I will add to that I thought was really interesting, that is in the ebook, but also a theme that I continue to see at these events, is where we're meeting people where they are instead of asking them. And I say we, but the healthcare leaders, because I'm in marketing. But they're meeting people where they are. So, a lot of times these, they're actually using geographical public data, to understand what areas are at higher risk. And we only have so many physical bodies that we can deploy. But we can actually use, we're all on our smartphones. Most of us have access to emails and internet and all those things. So if people are constantly on their phone, maybe they're deploying a text message to remind somebody about their breast cancer screening, so really finding where are their heightened risks, and then going through the channels of communication to send those messages, whether it's email, phone calls. So, have we answered the call to your question and fixed this today? No, but I do think that COVID, as awful as it was, I think it did increase awareness on, the health disparities. And I think as long as we don't lose sight of that and we're able to bring on AI technology, I think that there's a lot more hope than we've had before.
Yeah. And even just the simple aspect of meeting people where they're at in the form of those communications has such a profound effect, because I think we're still trying to figure out, where can we hit people most? Where can we make an impact on them most? The other question that pops up for this, though, is when you said, give everyone a Fitbit, and we're talking about the data that we're finding here. What do you think about the aspect of what do people do with this data? Sometimes this can be extremely overwhelming. And I kind of go back to this book I read a while ago that kind of emphasized the idea that sometimes if we're measuring so many things, we make it make meaning. And sometimes it doesn't really have that broad of a meaning in the grander scheme of things. So I don't know. Do you have any thoughts on that, feedback there?
Yeah. So it's really interesting. So two thoughts hit my head on that. And one, it immediately defaulted to another, the HIMSS speakers and sessions were just phenomenal. And so my brain immediately defaulted to another session that I heard where the guy said actually they were running a trial program.
Mm-hmm.
And we're giving this girl so much data that she got so focused on all these things that it was actually doing more harm than good.
Yeah.
And so absolutely, your question's valid. And so they actually almost stopped the trial, but instead they pivoted and were able to, work with her and whatnot. But I think this almost goes back to our bread and butter, Angel, which is marketing and understanding you can't spray your, target audience with a fire hose. You really have to have a targeted message that's going to matter to them.
Right.
And so I think, to your point, with all this data, it is working with your clinician to understand, well, what matters to me and what do I need to pay attention to. And that's where we're actually opening up this whole other world that we've long awaited, which is real dialogue and shared decision making between the patient and the clinician. And AI, once again, is opening that space up like never before. And we know, those in the space of the healthcare space, we know that when a patient is engaged with their treatment and their care, they're more likely to have that medication adherence, that treatment adherence, and therefore, hopefully, more optimal outcomes.
We can use AI to be more efficient in our roles, but nothing will ever replace the human touch needed, especially in healthcare. And physicians aren't going anywhere. Our healthcare providers are the folks that we need to lean into. And this segues a little bit to the physician burnout conversation, but to close up on that, I think that there's a lot of personal touch points that are great when you have that data, but unless they understand how that all comes together in the grand scheme of things for their individual body, then it's all just data. It's all just more and more information that they're due to consume. And I know for me, sometimes I'm like, okay, a little overwhelmed here. How do I make a decision based on this, but then still, get to be creative with things that I love and enjoy also. So let's talk physician burnout, because this is a topic I had a recent guest on. So Dr. Amna Shabir, she was a guest of mine, that incredibly talented physician in the Duke system. She was a fellow classmate of mine at the Duke Integrated Health and Wellbeing Coaching Program. And her entire focus now is on coaching early stage physicians that are going through burnout, or physicians that are mid in their careers that are experiencing this, based on her story. So I'll link that into this discussion as well. But curious, as we bring that red thread to AI, what are you seeing in physician burnout, and how AI is creating a resource for those physicians?
Yeah, I love that question as well. I will say that was a great episode. I highly recommend anyone in the healthcare space to listen to it. It is wonderful. But yeah, so that was another area that really excited me, and because for a few reasons. So one, I actually learned, and this was through another conference that we haven't even touched on. It wasn't local. It was Vive, which is a subset of HLTH. But Vive, I actually met a company that they use AI to look through the actual hospital systems or healthcare facilities data and flag physicians that are at risk for burnout. So that to me is fascinating, because the whole idea of AI in that area, but also what I'm about to share, is that AI can quickly go through massive amounts of data that clinicians or, hospital leadership would not be able to in a time of the day. And so in that sense, it's great to know that there are opportunities to leverage AI solutions like that to identify, hey, this person's, spent this long on patient care, this long in the EHR. We really need to pull them back, give them support. So it's great to see AI is actually actively and proactively seeking out to help our physicians. But in the more day-to-day scheme, there's implementation of, there's a ton of cognitive burden. So when a physician is trying to wade through all of this data, AI can actually do that for them and pinpoint what they need to see, specifically about this patient. There's so many technologies out there, Angel, that I could name, but there's a couple that I really like. One is actually it takes the notes and puts them into the EHR for the physician. So the physician's not over there typing. You may have gone to the doctor and it's like, okay, they're not even looking at me while I'm talking to them, and they can't, because they have to capture this critical information, right? But there's these AI services that will actually take those notes for you, only the things that matter to you. So if you're talking about your kid's soccer game, they scrub that out.
Talk to text, you mean? Is this the format?
It's beyond talk to text. It's actually an AI solution that's just taking these notes from the conversation. And so that's a partner that we get to work with in my agency. But the point of all of this is it's making sure that we're actually letting, because to your point, which you said is critical, the patient clinician interaction, that's never going to go away. And when you look at surveys, that's actually the part patients like the most. And that's what doctors want. That's why they signed up. It's human connection. It's what we live and breathe for as humans, right? Even beyond the clinician patient interaction. So being able to take the doctor's eyes off the charts and onto their patient is huge because of AI. Being able to pinpoint anybody that's at risk of burnout is a great workflow solution. But what's more is that there's also a lot of repetitive tasks. I mean, anytime we go right to the doctor, you're filling out the same form 16 times. You're like, I've already told you my birthday. I've already told you these things. So, all of our hospital staff and nursing staff are also filling out the same things over and over again. So having an AI solution that can plug and play or, move around schedules, hey, I can schedule this doctor for surgery here. Those are things that are able to give our overstaffed, overrun physicians and hospital, workers more breathing room and more space so that they can focus on actually what they signed up to do, which is take care of the patients.
Yeah, that's a good point in diving into the amount of administrative tasks that are left to physicians, aside from having to understand, hey, how do I help this patient? One of the underlying things that I was curious about, though, is, are we thinking in some capacity, some of these notes, I mean, even ChatGPT, there's opportunities where I've taken where I'm like, okay, I need something explained to me, put together these three concepts and how do they fit together? Is there opportunity where something like ChatGPT can be making a diagnosis?
So I think that goes, this is, my personal reaction to your question. I think that goes back to the human has to be in the loop.
Yeah.
So we absolutely have AI that can look at images and say, hey, this is, a flag. We have AI that can say this person needs to be triaged ahead of this patient. Because, there is we have to pick, right? Again, limited staff, limited time, for treatment. But at the end of the day, there does need to be that human in the driver's seat because it's up to the provider's discretion. We're dealing with human lives. And that's why healthcare is such a highly regulated space, and rightfully so. I mean, we are dealing with people's lives. I say we. My clients, at the end of the day, my role is to tell these stories. And so, I'm very passionate about what they do.
Yeah. Well, I think it's a fun aspect of our roles too in the marketing space, where we get to learn about all these different things that are out there and work in specialized fields like healthcare and even aesthetics, where my field lies. So it's an exciting opportunity. I mean, I think I look at AI and I'm like, this is awesome and terrifying. And is the world going to implode, or are we just going to be 10 times more efficient and get parts of our life back? And make better decisions. And, one thing, the kind of thread from another conversation and interview that I did with Cole Baker Bagwell, who is a mindfulness executive coach and works with, high-level executives across corporations that are experiencing burnout. She's very confident that the more empathetic we can be in the way that we ask questions to AI and operate AI, that AI will begin to bring that back to us in a more empathetic and even emotional way, which, I guess empathy is emotion, but you get what I say. I think it's, there's so much opportunity there, so much opportunity. And from this conversation, I'm going to link your ebook. I suggest everybody go and check that out. I'll have your LinkedIn on there. So please connect with Vanessa. And what other links and channels and ways to connect with you? Where can we find you? What topics do you speak on? I'll leave that with 4 questions for you there.
All right. Hopefully I'll get them all. So you can find me on LinkedIn. Antenna Group is the agency that I work with. So you can reach me at vanessa.donohue@antennagroup.com. I'd love to continue this conversation, the other topics that I can speak on or cover, or really how we can take marketing into this conversation. You know,
Yes.
what we didn't get a chance to cover, and I'll be super quick, is that, you know, all of these companies are doing beautiful, incredible things. But if you have this light and you hide it under a cup, what good is it? And so the role of marketing is to be able to take that story above the noise. And healthcare
Mhm.
is a very highly skeptical and regulated space. So bringing on the right partners to be
Yeah.
able to do that with deep domain expertise is critical,
Mhm.
especially with these conversations that really could change the world and change our lives.
You got it. You said it. Well, Vanessa, thank you for your time and sharing these insights. I'm excited to continue to follow your conversations on AI in the healthcare space. And I have a feeling we'll be meeting very soon to start diving into some of those healthcare marketing questions that we have.